Well, when your doctor says that your A1C or average blood sugar over the course of the last 3 months is too high, like 7.5, and it should be 6.5, question is, what do you do? Or what do I do? Because this is what I heard a little bit earlier today. So for me, I come back to the place where where I feel most comfortable and most at ease, the place where I feel connected. And for me, that's like right here in my jiu-jitsu school. And right here in the middle of Super Kids Academy and in the middle of all the things that I enjoy and love and do. And I just have a seat here with my surfboard and my guitar and the Super Kids Academy oath. I think coming back to our basic intention, and this pretty much summarizes mine and in all of my efforts. I'm a unique person and I'm here for important reasons. And I vow to always do my best to learn and grow stronger and wiser every day and to help my family, myself, and our society be the best that we can be. So that intention, well, the question is, what is your intention? So that's my intention. And so coming back to this basis, and then the question becomes is, if we get scared, and my doc laid out all of the risks and was able to give a risk profile, and I didn't like the numbers at all, right? I want like 100% chance of everything going well, right? I don't want to hear that it's like 72% chance of things going well and 28% chance of like heart attack or stroke or all these problems. I didn't like those odds at all. So, I want to increase my odds of doing well. So the way I am doing this and the way I am kind of going on this journey, and I invite you to come with me if you like, is I'm coming back to the basics of my mindfulness practice. I'm coming back to the basics of my intention. I'm also coming back to the basics of making sure that I get enough rest and enough exercise and balanced with work, and we'll talk about that a little bit later. I'm also coming back to what's a basic plan in terms of like, what am I putting into my mouth? For me, I think the plan is that I use food like a medicine, like Hippocrates originally said. He said, let food be our medicine. So my first thing I'm having after my doc talked to me about this is I'm going to have some tuna with no mayonnaise in it, so lean source of protein. And I'm going to break this can in half and eat half of this can along with about a cup of broccoli. And I'm going to have about 2 tablespoons of hummus. And so I'll have a little bit of carbohydrate and a little bit of healthy type fat that's in here. I'm just going to have 2 tablespoons. I'm going to have this type of meal 6 times a day. About every roughly 2 to 4 hours, I'm going to eat this style of meal one way or the other. And I'm not going to think about what I'm not going to have too much. I know it's like, for me, cheese and eggs and bacon and cheeseburgers and bread and all, I think, that has not treated me well. So I don't want to get too focused on thinking about, what I can't have, because I can have those if I want to have those, but I'm going to choose. I'm going to make a powerful choice for my well-being and my family's benefit as well, and our society's benefit as well. I'm going to make a choice of thinking positively about the things that are going to serve me best. And everything I put in my mouth, I'm going to treat it as an actual medicine, starting with this meal here. Thanks for joining me. There's more to come.